Health Navigator at the KU Alzheimer's Disease Research Center. Have you ever had any of these thoughts cross your mind? Like, I'm noticing memory changes, now what? You know, who can or should I talk to about memory concerns, whether they be for yourself, whether they be for a family member, for a friend? You know, my parents had Alzheimer's disease. You know, what can I do to lower my risk? My parent or spouse is having memory changes and I just don't know what to do. I don't know who to talk to. How can I find resources in my area? You know, how can I help my older parents from afar as they're aging? You know, how can I talk with my parent or my spouse's doctor about concerns? Just know that you are not alone in thinking some of these things. Some other thoughts, you know, what can we do to help prevent Alzheimer's disease? What does participation in research look like? What types of research is done at the KU Alzheimer's Disease Research Center? Who can participate in Alzheimer's research? What programs and resources are available for me at the KU ADRC and in my community? If any of those things have come to your mind, you're definitely in the right place. A little bit about my background. I've been an educator, a nurse, as well as a former family caregiver. As an educator, I did a lot of wellness coaching. I was a physical education and health teacher. So a lot of my background is in preventative exercise and wellness. As a nurse, I've worked in several different environments. I've worked as a primary care nurse. I've worked in hospice. I've worked at the memory care clinic prior to my job as the Brain Health Navigator. And I was also a caregiver to my mother who had primary progressive aphasia and Alzheimer's disease. I also had a father that had cancer and lots of other multiple comorbidities, and he was the primary caregiver to my mother. So what does the brain health journey look like? Everyone's journey is different, but in a lot of ways it's the same. Some of the most common things that people struggle with along the journey is knowing what to do, who to talk to, what resources there are, and where to find them, and how to handle concerns when you feel like nobody else is listening. So I wanted to share a little bit about my own personal journey. In 2008, I noticed that my mom was starting to have some, you know, forgetfulness. You know, she would forget what she was going to say, or she would tell me the same thing over and over again, you know, not necessarily like in a row, but, you know, maybe 2 or 3 days later, and not remember that she had already told me. So, you know, at that time, I didn't really think much of it. I actually kind of, you know, joked about it. Oh, Mom, it's just your Alzheimer's, you know, not really thinking that there could be any true concern there. We didn't have any kind of family history. But then I noticed in about 2009, we lost her mom, and her symptoms started to increase. She definitely was having more difficulty with word finding. Sometime between 2010, 2011, her symptoms had been pretty stable, and she was able to somewhat compensate to make them less apparent. So if you weren't with her a lot, you would have had no idea that she had anything going on that was more than, you know, typical for her age. In about 2012, her symptoms were really starting to worsen, and specifically the word finding. she would know what she wanted to say, but she just couldn't get it out. And I know myself and my dad would not help that situation a lot of times, because we could, we kind of could figure out what she wanted to say, and we would speak for her and not let her speak for herself. But during that year, she became a lot more dependent on my dad and others. That year, it was definitely apparent that her symptoms were worsening. She had gone and been evaluated sometime in 2010, 2011 by a neurologist, but I was not aware of that. She didn't talk about it. But they had put her on Namenda, and she had gone back and just finally came to me and said, Amy, I don't feel like they're doing anything for me. I don't know what to do. They really hadn't given her a diagnosis. So at that time, I took her for a second opinion. And that's where we got the diagnosis of primary progressive aphasia. She was having trouble with some executive functioning. We were on a trip to Las Vegas, and she had, you would have thought that there wasn't much wrong with her. But then when it was time to go home, she had packed all the contents of her purse into her checked luggage. So when we went to go through security, she had no identification. And with the primary progressive aphasia, she had trouble, getting out what if she knew the answers to the questions, she probably wouldn't still be able to answer them. So this became an issue. They wouldn't allow, anyone to help her. So luckily she was able to get through security and get on the plane. But this was a big learning experience for the family. Another situation that, happened that year, and she was still driving. Between 2012 and 2013, she was driving. She was still at home. But she was beginning to withdraw from, social situations. She was an avid, every month she would go out and go to lunch with some of her lady friends from high school. And she was very active. She would volunteer, but she was starting to withdraw from some of those situations. She also was starting to withdraw during even just family gatherings. Typically, it was just our family is just my mom and dad and I. So it was more when we were together with our extended family, her siblings and their children. And they started to kind of notice that something wasn't right. She really started to struggle, and we knew that it was time for her to not be alone when she got a phone call from some woman who was accusing her of stealing her iPhone. So during this situation, her executive functioning was definitely impaired. She gave the lady her address. She was home alone. My dad was working. And so she was at least recognized that she had done something wrong and didn't let the lady in the house when she and another gentleman showed up. But the police were called. They had to search her house. And at that time, we felt like that she could no longer be by herself. About 2014, she had finally stopped driving a little before then. She was definitely having a lot more anxiety. She was having trouble performing her, ADLs, starting to have, loss of bowel and bladder. And about that time, well, 2015, she really started to decline to where she was having behavioral changes that made it very evident. We were able to get hospice. Coming into the house, she was admitted to hospice in April of that year, and then admitted into memory care in July. And then by October, she was discharged from hospice because she was improving when she actually was admitted into memory care. During that 2015 year, I struggled to try to keep her active. I knew that it was important that she needed to keep her mind and body moving and not just sitting around. Typically, they withdraw from everything that they normally would love doing. She even got to the point where she didn't even care to watch television. So that was one of my biggest struggles, was finding things for her to do. Once she went into memory care, they had activities, they engaged her, and we just saw a huge improvement. I definitely would have never wanted to have to place her in a facility, but between myself and my father, we could not just keep taking care of her at home. And I honestly feel like if I didn't have the education and background that I did, that she probably wouldn't have lasted at home as long as she did. She was stable for a while when she was admitted to memory care. But in 2016, we lost my father. And we started noticing significant behavioral changes at that point. She had a flat affect. She cried frequently. She was a lot more easily agitated. I sometimes would call her the Incredible Hulk, because she could go from being, the sweetest lady to just like getting so angry and tensing up and shaking and like this, that she looked like the Incredible Hulk. So I kind of had to laugh at that, because without that, I probably would have wanted to cry. She also began having altercations with some of the other residents, which ended up with a Jerry Psych admission. In like a 3 or 4 month time frame, she was admitted to Jerry Psych twice. After that was admission, she started losing weight. She started falling. She started having, recurrent UTIs, and her agitation became much more increased. My husband and I had gone on vacation for 10 days. And prior to that, she was ambulatory with the assistance of a wheeled walker that she didn't necessarily need, but it just definitely helped with stability. To when we returned, she was no longer ambulatory. She was totally bedfast, and not wanting to eat. So she had a quick turn for the worse. She had been then readmitted to hospice. We had to move her to a different facility. And by 2017, she was actually doing better and was going to be discharged from hospice. But in mid-February, a couple days before her hospice discharge was to be, she actually fell ill and then ended up passing away in March of that year. So we had about close to a 10-year journey with the disease, which wasn't necessarily the funnest. This quote here definitely radiates with us, that to get through the hardest journey, we need to take one step at a time, but we must keep on stepping. There will be a lot of times that you'll want to give up. You won't, because there's so many different reasons, not knowing what to do, where to go, being physically exhausted, being emotionally exhausted. And so one thing that we want you to know is that there is help out there for you, and we are here to help. So at the Alzheimer's Disease Research Center, we know that no one can battle this disease alone, which is why we provide access to direct care, research studies, strategies to support brain health to our community and our region. But in addition to conducting the research to try to eliminate this horrible disease, we also offer programs on prevention, like our LEAP program. We have disease-related educational opportunities, like our My Alliance weekly emails and these webinars that you're attending today. We also offer patient and caregiver resources and support for our cognitive care network and support groups, and then access to our Brain Health Navigator, myself. So some of the programs that we have, which some of you guys may already be familiar with, especially if you're on this webinar today, are our LEAP programs, which LEAP stands for Lifestyle Empowerment for Alzheimer's Prevention. And it's a program that translates the latest Alzheimer's disease prevention research into actionable recommendations for everyday life. We have the LEAP Brain Health Bootcamp, which is a free 6-week online course that includes 6 modules with evidence-based strategies for reducing your Alzheimer's risk. And then we also have the Mediterranean Diet course. This is a free 4-week online course that covers the details of this brain healthy eating pattern and provides easy cooking tips, tricks, and recipes. The Mediterranean Diet course is offered currently about 4 times a year. And there should be another course coming up sometime late summer, early fall. They currently are in a 6-week course of the Brain Health Bootcamp. I believe we're on week 4. So that will end here in a couple of weeks. And then shortly after that, we will start a new bootcamp for those of you that are interested. The other program that we have here is My Alliance for Brain Health, which you're probably aware of, that you can get customized communications and resources based on your needs and interests. Some of you may have no connection to Alzheimer's disease or dementia. Some of you may just want to know, what can I do to prevent it? Or I have a friend who their mom has Alzheimer's and I want to help them to discover resources or see how they can help prevent it for themselves. Access to research, support groups for our care partners. The mindful minutes are great. Another program that has recently started is the Brain Health Navigator. So as Dana said, the Brain Health Navigator is the first point of contact for individuals who are seeking information on programs and resources related to brain health that are offered through the KU Alzheimer's Disease Research Center and within the community. Some of the things that I do as the Brain Health Navigator is I provide education and tips, on how to recognize the difference between dementia and normal memory changes as you age. Can provide some guidance on how to talk to your doctor or when to talk to your doctor if you're noticing memory changes for yourself or a loved one. I will soon begin performing memory screenings and being able to provide some feedback to share with your healthcare provider to help them to be able to get the appropriate workup and diagnosis if you truly are having some memory concerns. Helping you make connections with clinical resources such as the memory care clinic, also our cognitive care network. We have lots of services that provide vital support and information. Provide tips on just general brain health and Alzheimer's prevention, and provide advice on how research participation can provide personalized information about your dementia risk and opportunities for investigational memory treatments. One quote that I have always stuck to and is the main reason that I am here today is this here for my mom. I always said, I will remember for you, I will advocate because of you, and I will one day honor the memory of you, always until the sun will rise over a day without Alzheimer's. So that's a little bit about myself, my journey, my job here at the ADRC, and I want to open up time for people to, ask questions, pick my brain, whatever, any questions you may have. You can share them in the chat box and I can answer.
Amy, thanks for the presentation and sharing your story with us. My apologies for joining late. Does anyone have any questions in the chat that they would like to share with Amy?